Hey everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. Thanks for joining me today. I'm excited because today's topic is something super special and dear to my heart. Plus, September is National Awareness Month for the topic that I'll be talking about. So today I'm going to be talking about childhood obesity, the rise of an epidemic during a pandemic. And September is National Childhood Obesity Awareness Month. And this is so important because today I'm just going to talk about the impact it has on our children and also just the future impact it has on children as they grow up and how it will impact their adult lives. Some of these numbers are so astounding. So I'm just going to give you some statistics initially. So the Centers for Disease Control has stated that childhood obesity affects approximately 1 in 6 kids. That's pretty crazy. That's 1 in 6 kids. So again, if you live in a neighborhood and you look down the block at 5 houses, that's 6 houses total. That means at least one child out of those 6 houses, and that's at least one child, is obese. How crazy is that? Also, if you have a classroom that has 15 kids, that means, again, at least 2 children are obese. And again, this isn't counting kids who are overweight. This is just talking about obese kids, because as adults, we have normal weight, overweight, obese, and morbidly obese. So this isn't even counting children who are overweight. So what is obese? What is the definition of pediatric obesity? So pediatric obesity is essentially when a child has a body mass index or a BMI that is at the 95th percentile or higher. So you may ask, what does that mean? So if you have any kids, when you go to the doctor, the pediatrician or your family doctor, they always tell you what your child is on the growth curve. And it's in percentiles. We do it for the weight, for the height. If you have a baby, we also do it for the head circumference. This helps us know where your child is falling, and plotting these charts helps us know how your child is growing and if they're growing appropriately. And part of this is, as far as 50th percentile, that's what's average. So then you can tell that, obviously 95th percentile or higher is super high. And we would say they're off the charts is what we would say. So again, you really want to be average at the 50th percentile. And just so you know, a lot of times when we see smaller kids, so like babies, if they are larger, if they are longer, I know people are looking at those percentiles, but when they're that little, that really isn't a true reflection of the future. It's once these kids start getting around 2, so toddler age is really when these percentiles become important. And when the Centers for Disease Control or the CDC talk about these statistics, that's what's really playing a role in this. Now, some other statistics include that lower socioeconomic families do have a harder time and have a higher incidence of childhood obesity. And one, that's just because there's not a lot of access to healthy foods. And also some places aren't safe to play in where some lower socioeconomic families live. So that also plays a role. Now let's go through some risk factors for obesity. So first and foremost, there is lifestyle, and lifestyle includes diet and exercise. So this is so important, because if kids aren't eating well and they're not getting enough activity, that becomes such an issue. And then especially now during the pandemic, hence the name, the rise of this epidemic during a pandemic. During this time, kids have been even more sedentary, playing more video games, watching more TV. Now there's online learning, so kids are on the computer even more. So that has become an issue. And again, I'm going to mention even in adults have gained weight, and that includes, what we call the COVID-15, because it's the 15 pounds that's been the average weight that people have gained. So the same thing has affected our kids. Now, other factors include psychological issues. So studies have shown that kids who have depression, anxiety, obviously stress eat and have emotional eating tendencies. So again, COVID-19 has played a role and has impacted this situation too, because I've spoke about it before that we have seen a rise in depression and anxiety in our kids during this time. Now, the other thing we need to be careful as parents is we need to be an example. And you hear me say that over and over again on the show. We need to be an example because our kids follow what we do. So if we are, stress eating and in a frenzy, our kids will also stress eat and be in a frenzy. Also, if we're stress eating, most likely we have a whole bunch of snacks in the house and it's accessible to the kids. And of course, they will go for it. Now, the other thing too that's been shown is that, of course, genetics plays a role because, as I mentioned, if you have a parent or parents who are obese, the likelihood of bad foods or junk food being in the house are higher, and most likely those parents aren't doing a lot of activity. So the kids just follow suit. However, most recently, hormones have been shown to potentially play a role in some, I repeat, some people. And the reason is as we eat, hormones in our body essentially trigger our brain to tell our brain that we're full, to know to stop eating. However, in some people, this trigger or this sense doesn't work. So they continuously overeat, which obviously would end up in being overweight or obese. So that's something important. But then again, you need to remember this isn't the cause for everything. So don't go blaming it on that hormones. Now, what are some things that we can do to help our kids? And this is what's nice about preventative medicine, because we can prevent it. We can help our kids do better and live healthier lives. Now, one thing we can do is, of course, diet and exercise. So making sure your kids have access to good foods, nutritious foods, not just junk foods. Really, I encourage parents not to buy junk food, because remember, we're in control of what we buy. We go to the grocery store. I don't know, when I last checked, my kids don't go to the grocery store. I go to a grocery store and do the shopping and purchase the items. So if you don't have the items in your house, it is less likely for your child to have access to it. Or the other thing, it's okay to want, a snack, a cookie, chips once in a while. That's okay. Again, moderation, moderation, moderation is key. But the thing is, you don't want them, again, to be accessible to your child. So put them in a spot where your child can't easily get to if you're not at home and you can't watch them. If they do get a snack, I always encourage parents to, set that portion size. So if they're getting chips, don't just give them the whole big bag of chips. Give them the serving size that's appropriate for them. And then once they're done, that's it. The other thing is activity level. So make sure that your kids are getting enough time outside, enough exercise, enough playtime. Right now, it is a struggle with screen time. For kids who are over the age of 2, we recommend no more than 2 hours of screen time during the day. But obviously, with virtual learning all over the place, this definitely puts a damper in that guideline. So what the recommendation is that once your kids are done with school, have them do quote unquote offline activities. So don't have them go play video games or watch a movie. They've already been on the screen doing work or homework, whatever the case may be. So it's time for their eyes to get a break. It's time for their brains to get a break. It's time for their bodies to become active. A couple of things that I've seen and read is that some people are putting their kids, for example, on like a bike while they're in school, like a home bike that you just get on, because one, it's been shown, essentially parents are saying that their kids are focusing more because when they're doing virtual learning, they're just sitting there and the teacher's teaching them, so they're not very interested. But having them do something else helps, and that activity does help. Of course, you want to monitor that because you want to make sure that your kids are getting hydrated if they're going to be on the bike for such a long time. The other thing too is when kids during virtual learning, they usually get breaks in between classes. So you want to make sure that your kids are getting up, they're moving around, they're just not sitting there or like have a video game next to them. So they grab the video game during the breaks and just start playing the video game. You really want to encourage your kids to get up and move around. Now, even the American Academy of Pediatrics, if the child is a school-age child, usually about 60 minutes of activity level at least almost every day is recommended. And if a child is anywhere from about 3 to 5, it's recommended up to 3 hours of activity during the day. So these are pretty good. And this is how you burn calories too, because the other thing, if somebody's not eating foods that are good and they're sedentary, you're not burning any calories. So for example, you can eat fast food every day. You literally could. The thing is, you would have to exercise enough. So when you're not eating, essentially you would just have to exercise in order to burn those calories that you're eating. So if you want to take in 5,000 calories, that's fine. But you know what? You need to work out and burn 4,000 of those 5,000 if you don't want to gain weight. So that's where that balance comes in. Now, the other thing, of course, I talked about psychological issues. And again, you've heard me mention this before, that communication with your child is so important to see how they're doing. Also, just staying in tune with your child. If you feel that something's different or something's changing, if they're moody, irritable, if they're starting to isolate themselves, if something just seems off, definitely just check in with your child, because studies have shown that kids who are obese are at higher risk of depression and isolation, and they're also at higher risk of being bullied, which of course again increases the risk of anxiety, also increases the risk of suicide. So those are very, very important things. And you again have heard me say on other shows that definitely have a time of communication at least once a week with your child, especially now with virtual learning, just to check in, see how your child is doing, if they feel like they're doing great and tolerating all the changes that are having, and then just succeeding in general. Those are very big. Now, of course, we have what we talked about, the low socioeconomic situation. So again, we see that lower income families do have a tendency to buy more snacky foods and unhealthy foods. And that's because, of course, you see it. If you go to the grocery store, organic food is more expensive. Fresh food is more expensive. So this really puts a limitation on that. Also, as I mentioned before, some lower income areas may not have a safe place, like a safe playground, even though some playgrounds are still close, or just a safe place for kids to ride their bikes. So again, there's just a higher level of obesity seen there. Now, with this being said, if we don't really try to work with our kids and get this obesity level down, what sort of things are we seeing? So one, these kids as they grow up are at higher risk of heart attacks, strokes, diabetes, high blood pressure, high cholesterol, sleep apnea, asthma, fractures because, their bones are having to carry more weight. And what's even more disturbing right now is that we're seeing these disease processes even earlier. So they're being diagnosed and occurring earlier in these kids' lives. So it's not even that, kids are obese, that when they grow up as an adult, they have a higher risk. So it includes that. But now we're just seeing diabetes, high blood pressure, high cholesterol, sleep apnea earlier and earlier in kids. And these kids, like adolescents, are having to start medications such as metformin or a blood pressure medicine. And I mean, these just aren't good things, because one advantage of being young is that your metabolism is up much faster. So it's such a great thing that, if you get your child out there and they're moving and active, they can do so well and stay healthy. But if a child is just sedentary, I mean, it's just not a good thing, and it ends up pretty bad. So again, today and during this month of National Childhood Obesity Awareness Month, take the time that, if you have kids, definitely make sure your kids are getting their checkups, because at the checkups, you just want to know where your child is falling on the growth curve. Definitely talk to your physician or your child's physician about more tips, how your child can be healthy. Also, don't forget to check me out on Instagram at drmom_show, and on Facebook, the Dr. Mom Show, because this week itself, I'm giving tips on how to help your kids stay healthy. Yesterday, I talked about eating breakfast. Breakfast is so important to get a child's metabolism going. It's been shown to help with memory. It's been shown to help with mood, so your kids aren't irritable or hangry, like they say in the South. Today, I even have up there just a chart from the American Academy of Pediatrics, which just shows the portion sizes and appropriate serving sizes for your child based off of their age, because that's another thing that happens. People have a tendency, and it's also a cultural thing, to force their kids to eat, that they expect their kids to eat a certain portion of items. And it's so important to know how much your child is supposed to eat, because again, you want them to be eating healthy. And the other important thing is that during these growth spurts, you want to make sure you aren't giving your kids a whole bunch of snacks when they're growing. You want to be able to give them nutritious foods. Now, I will say that when your child goes through these growth spurts and they eat more, definitely, again, just encourage them to try and beef up on protein, dairy or calcium, fruits and vegetables. Those are all great things that they can do. And like I mentioned, just have those nutritious things that are accessible to them, and not unhealthy or sugary items more accessible to them. Because of course they're going to grab what's closest to them and what's easiest to them. So make sure it's something healthy and something good. And definitely keep checking out this week all the tips that we have, because again, we want our kids to be healthy so they can live long, happy, and healthy lives. So again, don't forget to share the video. Don't forget to like it, comment, and share it. Also remember, you can check out the Dr. Mom Show on both YouTube and the podcast, either on Radio Love, or you can check it out on different platforms like Spotify or Apple Podcasts. Don't forget to rate it, like, and leave a review if you love this show. Also remember, if you have any topics that you want me to talk about, I'd be more than happy to talk about them. So definitely, hit me up with those. And of course, check out my website, drdarlenemushalak.com, for all the great stuff coming up. I am excited because at the beginning of October, I'm doing a workshop to help boost your immune system. You can find that again on the Facebook page and also on the website, and it's even listed on Eventbrite, so you can check that out and get signed up for that. And then of course, don't forget to subscribe, like, and share with your friends. And I hope you guys have a great day. And of course, don't forget, wash your hands, kiss your kids, love your family, and say your prayers good night. Bye-bye.